Welcome to the deep dive. Today, we're going to get into, well, a pretty incredible journey, pregnancy.
That's right. We've got this document, pregnancy.pdf, and we've really dug into it.
Yeah, the plan is to pull out the key milestones, what it actually feels like, and the really important things to consider, start to finish.
Exactly. For anyone wanting the real story quickly but thoroughly, we're aiming to highlight the most significant bits and maybe some surprising ones too.
Okay, let's jump in. So, the basics. How long are we talking? About 40 weeks?
Usually, yeah, around 40 weeks, and that's
Mhm.
typically counted from the first day of the last menstrual period.
Right, and it's split into 3 parts, the trimesters?
That's the standard way to look at it. First trimester is weeks 1 through 13.
Okay.
Second is weeks 14 to 27. And the third trimester runs from week 28 right up until the birth, which, could be around week 40 or even a bit later.
And these aren't just random splits, are they? They mark big changes.
Oh, absolutely. Huge shifts for both the baby's development and for the pregnant person's experience.
So let's talk baby development first. That first trimester sounds intense, weeks 1 to 4.
Very intense. You've got fertilization, then implantation into the uterus lining, and this massive surge of hormones kicks in. Really sets everything off.
Wow. And then weeks 5 and 6, I hear that's a big milestone.
It really is. The heartbeat begins. Think
Yeah.
about that. And the neural tube, which becomes the brain and spinal cord, starts forming. It's just fundamental stuff happening so early.
Incredible. Okay, moving on, weeks 7 and 8.
You start seeing limb buds, the beginnings of arms and legs, and facial features are starting to take shape.
And by weeks 9 and 10?
The major organs really get going with their development. It's a critical period.
And there's a name change around then.
Yes, exactly. Up until the end of week 10, it's called an embryo.
Okay.
From week 11 on, we call it a fetus.
Yeah.
And in those weeks 11 to 13, the fetus actually starts making tiny movements.
Can the mother feel those yet?
Usually not yet, it's too small. But things are moving, and the external genitalia are developing too.
Okay, so that's a whirlwind first trimester. What happens when we hit the second one, weeks 14 to 27?
The second trimester often feels a bit different for the mother, maybe a bit easier for some. For the baby, development continues fast. Weeks 14 to 16, you can often tell the baby's sex on an ultrasound.
Ah, the big reveal for some.
Yeah. And lanugo starts growing that's like a very fine, soft hair all over the body.
Right. And what about movement? When can you usually feel something?
That's often between weeks 18 and 20. It's called quickening. Those first
Yeah.
little flutters or taps.
Must be amazing to feel that for the first time.
People describe it in all sorts of ways. Then weeks 21 to 24, the skin is developing, getting less transparent, and the baby starts making breathing movements. Not breathing air, of course, but practicing.
Practicing. Okay, getting those muscles ready.
Exactly. And by weeks 25 to 27, the nervous system is growing rapidly, and believe it or not, the eyelids open.
Wow. Okay, homestretch third trimester, week 28 onwards. What are the highlights?
This is really about maturing and getting ready for birth. So weeks 28 to 32, the brain develops more complexity, getting those familiar grooves, and the baby starts putting on fat.
That's important for afterbirth, right? Temperature control.
Vital, yes. Then weeks 33 to 36, a really critical step. The lungs mature significantly. That's key for breathing independently.
Makes sense.
And around this time, the baby often settles into that head-down position, getting ready.
And then the last few weeks, 37 plus.
From week 37, the baby's considered full term. So mostly just growing bigger and stronger, putting the finishing touches on development.
It really is an incredible timeline. But of course, it's not just the baby changing. Let's talk about the mother's experience through these trimesters. First one, we hear about the nausea.
Oh, yeah. First trimester symptoms are pretty well known. Fatigue is a big one, just feeling wiped out. Nausea, definitely morning sickness is kind of a misnomer. It can be anytime.
Right.
Mood swings are common, food aversions or sudden cravings. Bloating, too. That's all pretty standard.
But there's some other stuff too, maybe less talked about.
For sure. A lot of people notice a heightened sense of smell, sometimes really intensely.
Superpowers.
Almost.
Yeah.
Vivid dreams are another one people report. Sometimes a weird metallic taste in the mouth. And constipation can be an issue, too.
And this is all down to
Hormones, pretty much. Rapidly rising levels of HCG, progesterone, estrogen. They orchestrate everything, but they also cause these side effects.
Okay, so then you get to the second trimester. Does it get easier?
For many people, yes. That intense fatigue might lift. Energy levels can return, which is a huge relief. And the nausea often fades.
Thank goodness.
But physically, things are changing visibly now. The belly's growing, obviously. Skin stretching, which can get itchy. Backaches become more common.
Uh-oh.
and something called round ligament pain, sharp pains in the lower belly as the ligaments supporting the uterus stretch. Not fun.
Doesn't sound it. Anything else?
Yeah, interestingly, because blood volume increases so much, some people get more sensitive gums, maybe bleeding when they brush. And nosebleeds can happen more easily too.
Huh. Okay, third trimester. I imagine comfort becomes a major theme.
Definitely. Discomfort tends to increase. The baby's bigger, putting more pressure on everything: bladder, pelvis.
So lots of trips to the bathroom.
You got it. Frequent urination is very common. Sleep often gets more difficult. Finding a comfortable position is tough. And you might notice Braxton Hicks contractions more.
Those are the practice ones, right? Not real labor.
Exactly. The body's sort of rehearsing. They might get stronger or more frequent.
And what about emotionally?
It's a real mix. Lots of anticipation, excitement, but also maybe some anxiety about labor, birth, becoming a parent. And there's often this surge of energy called the nesting instinct.
Ah, yes, the sudden urge to clean and organize everything.
That's the one, preparing the space for the baby.
Okay, so alongside all these changes, there are things pregnant people need to be mindful of, things to avoid. Let's start with food and drinks. What's off the menu?
All right, this is important. Food-wise, the big ones are raw fish, especially stuff high in mercury. No unpasteurized dairy or juices, think soft cheeses, raw milk.
Listeria risk.
Exactly. Same goes for deli meats unless they're heated until steaming hot. Undercooked eggs or meat are out because of bacteria risks. And definitely avoid high mercury fish like shark, swordfish, king mackerel.
Got it. What about drinks?
Well, alcohol is a definite no-go. Complete avoidance is recommended. Caffeine needs limiting. The usual advice is under 200 milligrams a day, which is roughly 1 or 2 small cups of coffee.
Okay.
And herbal teas. Some are fine, some aren't well studied, so it's best to check with your doctor or midwife before drinking them regularly.
Makes sense. What about activities? Are there physical things to steer clear of?
Yeah, generally high-impact sports or anything with a high risk of falling or taking a hit to the belly should be avoided.
Like contact sports or maybe skiing later on.
Things like that, yeah. Also, activities that raise your core body temperature too much so. Long sessions in hot tubs or saunas are usually advised against. Heavy lifting isn't great.
Okay.
And after about 20 weeks, lying flat on your back for extended periods can potentially reduce blood flow, so side lying is better.
Good tip.
And obviously, smoking is harmful, and so is secondhand smoke. Plus, always check with a doctor about travel plans or any necessary vaccines.
It really sounds like having good support is crucial through all this.
Yeah.
Let's talk about roles. What's key for a partner?
Oh, the partner's role is huge. First off, emotional support. Just being there, listening without judgment, validating feelings, offering comfort. That's massive.
Just being present.
Totally. Then there's the practical side, maybe taking on more chores, errands, cooking, helping reduce the physical load.
Yeah, especially during that first trimester fatigue or third trimester discomfort.
Exactly. Attending appointments, especially things like ultrasounds, can be really bonding and supportive too. And honestly, just having patience. Patience with the mood swings, the physical limitations, the anxieties. It all requires understanding.
What about the wider circle, friends, family? How can they help effectively?
It's often well-intentioned, but sometimes support can miss the mark. Key things are offer specific help, like, can I bring dinner Tuesday? Rather than a vague, let me know if you need anything.
That's a good point. Makes it easier to say yes.
Definitely. And please avoid commenting on the pregnant person's body size or shape. Just don't.
Yeah, probably good advice generally.
Right. Also, resist sharing horror stories about birth or giving unsolicited medical advice. Respect their choices and boundaries. And be mindful they might be feeling overwhelmed. Don't add to their mental load.
Even coworkers can play a role, can't they, in a supportive workplace?
Absolutely. Just
Right.
being understanding about needing time off for appointments or maybe needing some flexibility, respecting their privacy, especially early on if they haven't announced it widely,
Right.
and maybe offering a bit of backup if they're having a rough day with symptoms. Small things can make a big difference.
This brings us to talking about pregnancy. Etiquette seems important here. How do you even ask someone if they're pregnant? Or should you?
The safest, most respectful rule is don't ask, just wait for the person to tell you.
Seriously, never.
Pretty much never. And absolutely never comment on someone's appearance as a hint, like, are you expecting, based on how they look. Let people share their news in their own time on their own terms.
Okay, that's clear. And why the secrecy, especially in the first trimester? Lots of people wait to announce.
There are really good reasons. Unfortunately, the risk of miscarriage is highest than maybe 10 to 15% of known pregnancies.
Ah, Okay.
So many people wait until that risk decreases. It can be incredibly painful to share happy news and then have to share sad news shortly after.
That makes a lot of sense, the emotional burden.
Exactly. Plus, some people just want privacy. They want time to process it themselves, maybe avoid the barrage of advice or questions before they feel ready. It's personal.
It feels like we maybe need to talk more openly about that, about early loss.
I think so too. Normalizing conversations around miscarriage and early pregnancy grief could really help reduce the shame and isolation people often feel. It happens, and it's okay to talk about it.
Yeah. Now, something else really important. Pregnancy isn't the same for everyone. We need to be inclusive, right?
Absolutely crucial.
Mm.
We need to remember and acknowledge that pregnancy journeys are diverse. Trans men can get pregnant. Non-binary individuals can get pregnant.
Right. It's not exclusively women.
Not at all. And we also need to think about surrogate pregnancies, the experiences of intended parents,
Yeah.
and LGBTQ plus couples using IVF, IUI, donor conception. There are many paths to building a family that involve pregnancy in different ways.
And how can we reflect that in how we talk about it?
Even small things help, like maybe using broader terms like pregnant person alongside mother, or adding a quick disclaimer acknowledging that people identify in different ways, just being mindful of the language.
Okay. Let's shift focus slightly to mental and emotional health during pregnancy. It's huge, isn't it?
It's just as important as physical health, maybe even more interconnected than we realize. Prenatal anxiety and depression are surprisingly common.
What kind of numbers are we talking?
Estimates suggest up to 20%, maybe 1 in 5 pregnant people, experience clinically significant anxiety or depression.
Wow, that's high.
It is. And even outside of a diagnosis, experiencing fears is normal. Fears about miscarriage, about the birth itself, about whether you'll be a good parent. It's all very common.
So what helps? What support is there?
Lots of things can help. Journaling can be great for processing thoughts and feelings. Therapy, obviously, talking to a professional.
Okay.
Support groups, connecting with others going through it. Mindfulness or meditation apps can help manage anxiety.
Hmm.
And really importantly, involving partners in emotional check-ins, making it a team effort.
Good advice. Now, sometimes stats help grasp the scale of things. Can you give us some quick, maybe visual facts about the changes?
Sure. The uterus expansion is pretty mind-blowing. It goes from about the size of a lemon
Tiny.
to roughly the size of a watermelon by the end.
Whoa, that's incredible growth.
Isn't it? And blood volume increases by about 50%.
Yeah.
It's a massive change in the circulatory system.
50%. Okay.
And those fruit comparisons for baby size can be helpful. Like week 10, maybe a prune, week 20, a banana, week 36, something like a papaya.
Yeah.
Helps visualize it.
Yeah, it does. Any percentages about common experiences?
Well, we mentioned nausea. That affects maybe 70 to 80% of pregnancies. To some degree, miscarriage, around 10–15%.
Right.
Preterm birth, meaning before 37 weeks, happens in about 10% of pregnancies. And C-section rates, at least in the U.S., are around 32%.
Interesting stats. Okay, let's quickly touch on the sort of life support system in there. The placenta, umbilical cord.
Yeah, the unsung heroes. The placenta is amazing. It's a temporary organ the body grows just for pregnancy.
Wow.
Its job is basically to filter blood, pass oxygen and nutrients from the mother to the baby, and take waste products away. Super important.
And the cord.
The umbilical cord is the connection, the lifeline between the fetus and the placenta. It typically has 2 arteries and 1 vein protected by this jelly-like substance.
Just fascinating biology. We should also probably acknowledge that some pregnancies have extra challenges.
Yes, absolutely. Not all pregnancies follow the standard path. There are high-risk pregnancies, maybe due to the mother's age, conditions like diabetes, carrying twins or more, or developing issues like preeclampsia. These need closer monitoring.
Okay.
Some people might need bed rest or face other medical restrictions. And pregnancy after a previous loss brings a whole layer of emotional complexity, often heightened anxiety.
Understandably.
And conditions like hyperemesis gravidarum, that's severe, persistent nausea and vomiting, way beyond typical morning sickness, can make pregnancy incredibly difficult.
Right. It's important to remember those diverse experiences. Lastly, what about the social side? Culture plays a role, too.
Oh, definitely. Lots of cultures have specific rituals around pregnancy and birth. Baby showers are common in some places, naming ceremonies in others. Even those gender reveals, though maybe with a nod to understanding gender is more complex.
Yeah.
And then there are cultural beliefs or taboos, things to avoid, things to do, like maybe avoiding cold drinks in Japan or avoiding eclipses in parts of Latin America. Fascinating variations.
And in our modern world, social media adds another layer, doesn't it?
It really does. There can be pressure to announce online, maybe sooner than you want, and then you open yourself up to, well, everyone's opinions and advice, solicited or not.
Yeah, the floodgates open.
It can be a lot.
Yeah.
Setting boundaries is key. Learning to say something polite but firm, like, thanks for sharing your thoughts, but we're actually doing things a bit differently, can be really useful.
That's a good phrase to have ready. Wow. This has been, well, a really comprehensive look. It's just amazing to think about all these changes, physical and emotional, all happening together.
It truly is. Whether you're going through it, supporting someone, or just curious, understanding these stages, the variations, the considerations, it gives you a real appreciation for just how complex and honestly wondrous pregnancy is.
So, thinking about everything we've discussed, maybe a final thought for our listeners. Considering that incredible interplay of changes, what do you think is the most surprising adaptation the pregnant body makes? Or maybe, thinking about all the different experiences and cultural views, how can we build communities that are genuinely more supportive and understanding for everyone navigating this journey?
Great questions to ponder.
Definitely something to think about. Perhaps delve deeper into some specific cultural practices or maybe the emotional journey of each trimester. Lots more to explore. Thanks for joining us for this deep dive.